Hi, I'm David Morris with Urology Associates, and here today to talk to you about bladder cancer. Bladder cancer is a diagnosis that often presents with signs of blood in the urine, and with signs of blood in the urine or problems with recurrent blood on microscopic checks of the urine. We'll often proceed with looking in the bladder with a camera, which is called cystoscopy. And if there's a growth or a lesion that's seen during that evaluation for blood in the urine, we'll often proceed with biopsying it or scraping off the area in the bladder that looks abnormal. The pathology report, after looking at it under the microscope, will often tell us that it's a type of bladder cancer of the lining cells of the bladder. And at that point, there's kind of two main paths that we go down in terms of treatment options. And it's really determined by how aggressive or how deep the bladder cancer grows into the bladder. And so I'm here today to talk a little bit about those two different options, just so you have an idea what to expect in terms of options after diagnosis and eventual treatment options. So this is basically just a graphic representation of your bladder. What you have here is the urinary tube where this exits out through the urethra. The bladder basically is filled with tubes that come in from the kidney on the backside and open up down here at the base as two little holes, and they continue up to the kidney. This is bladder muscle around the edge, and this is the lining cells of the bladder itself. The two different main distinctions we make for bladder cancer types are types that are just of the lining itself, and those that actually grow out into the space, but also deeper back into the muscle. And the reason that we make this distinction is that most of these cancers that are on the lining are most at risk for returning and causing problems down the road with regrowth. Once cancers get deeper into the muscle is when we worry that they could potentially spread. They can actually grow out through the walls of the muscle out into the surrounding fat, or they can spread through the lymphatic channels to some of the lymph nodes that surround the bladder. So we really kind of distinguish these two different types of cancers really in our different therapy options. So in terms of these cancers, what we typically will proceed with is something similar to what was done at the time of diagnosis, which is just scraping off this bladder lesion. Once all the bladder cancer cells are removed from the scraping, we then have two main treatment options available. If it's a higher risk area that may come back, and these can come back about 50% of the time, we'll often talk about putting chemotherapy or special medicine into the bladder that treats all of the lining of the bladder. So that will happen over about 6 different weeks of coming into the office and basically having a small catheter placed and having the chemotherapy medicine or BCG, which is a type of tuberculosis bacteria, into the bladder that basically coats the lining and causes a reaction which can reduce the chance that the cancer can come back. That's one option. The second option, if it's not a high-risk cancer, is just to put you on a surveillance program, which is coming in at 3 months, 6 months, a year, and then spacing it out down the road, looking in the bladder to make sure that there's no new areas. New areas can grow even though you're not having blood in the urine, which is one reason we do surveillance and checks of the urine, even though you may not notice blood yourself when you're urinating at home. In terms of cancers that grow deeper into the muscle, it's a more serious condition. And once cancer gets into the muscle, it has a significant impact on how long someone can live with their cancer. And so we treat that cancer very aggressively. And there's kind of 3 main paths that someone can go down at that point. The most common and kind of the best that we know of is to remove the entire bladder. That removes all the cancer cells that are in the muscle, hopefully any cancer cells that may have spread. It's often done at the same time as removal of lymph nodes in case there are any spread to the lymph nodes. And then at that point, there's a reconnection of the urine tubes from the kidney, usually using a piece of the bowel to either form a new bladder that's made of bowel or a connection that basically brings the urine through a little bowel segment up to a little opening in the belly wall, which then drains the urine into a bag. The bag can be changed, drained at home into the toilet, and you can basically do almost all normal activities even though you have a drainage bag with urine collecting in it. That removal of the bladder can be done by itself. It can also be done in combination with 2 other main treatments, which are chemotherapy and sometimes radiation. The radiation treatments and chemotherapy, when used in combination, are not typically as successful as removal of the entire bladder, but in some sick patients that are unable to tolerate a major surgery, that sometimes is the only therapy that can be given. And chemotherapy can often be used before or after surgery in case someone needs additional therapy if the cancer looks like it may be spreading. So those are the main treatment kind of options that are available for cancer that's on just the lining or cancer that has grown into the muscle and has the potential to spread. And your physicians here at Urology Associates can talk to you more about those two different main types and the different treatment options that are available.